Aurora BayCare Medical Center has a new tool that has the ability to pinpoint exactly where radiation treatments hit the body so that healthy tissue doesn't get zapped.
Shelley Botat tells us how it works in tonight's Health Watch.
It's called Vision RT, and it helped one local man keep his sight after a tumor grew back close to his optic nerve. 7 years ago, Dan Beck started having vision problems.
I had trouble seeing, noticing the captions on the TV.
So he went to the eye doctor.
They realized it wasn't my eyes, that they believed that I might possibly have a tumor.
Dan had a tumor the size of a golf ball on his pituitary gland.
Thank goodness that this was not cancerous.
But it could blind him. Doctors removed the tumor. However,
August, I went for my 5-year checkup, and they did find that the tumor had grown back.
Because of scar tissue from the first surgery, another one wasn't an option. So this time, Dan opted for radiation and went to see Dr. David Rohde at Aurora BayCare Medical Center.
So he typically would become blind if this were left to progress.
And because the tumor was growing so close to Dan's optic nerve, Dr. Rohde used the hospital's new TrueBeam Technologies Vision RT equipment, which can pinpoint where the radiation hits.
What's critical in providing these daily treatments is to make sure that you're on target. And because you're concerned about the nerves that supply the vision, you want to stay off of those as much as possible.
And although Dan wore a specialized mask to keep his head secure, he can still move.
If he even winked, it would notice that on the thing, and it would shut the machine off.
Saving healthy tissue. After more than 6 weeks of treatment,
it's expected to be curative.
Dan says he does get some mild headaches, but they don't last long.
I feel really good. You know, every time you hear about radiation, you know, it's a little scary. You know, things can go bad. You don't know. And this is new, and Dr. Rohde made me feel very comfortable, and we talked about the future, and if this tumor does not grow anymore, everything should be fine. And I'm not worried a bit.
Dan will have to continue going for MRIs to make sure the tumor doesn't grow. Aurora BayCare is the only hospital in Northeast Wisconsin that has the Vision RT equipment. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat.